The role of government in providing public goods is essential for the well-being and development of society. Public goods are goods and services that are non-excludable and non-rivalrous, meaning that once they are provided, they are available to members of society, and one person's use does not diminish its ability for others. The government primarily role in providing public goods is to ensure that provision in situations where the market fails to do so efficiently. This is because public goods often face the problem of market failure due to their unique characteristics. For instance, individuals may have an intensive to free ride and not contribute towards the provision of public goods, leading to underinvestment. To address this, governments typically intervene through public and policy and expenditure to provide public goods. This can be done in various ways. First example, direct provision. The government directly produces and supplies public goods using tax revenues or other sources of public funding. Example, including public infrastructure such as roads, bridges, and parks, as well as essential services like national defense and law enforcement. Second example, crew production. The government collaborates with private entities, non-profit organizations, or individuals to jointly provide public goods. This approach fosters partnerships and shared responsibilities in delivering public goods. An example is the co-production of public healthcare services by government hospitals and private healthcare providers. The third example, regulation and oversight. The government regulates industries and sectors to ensure the provision of public goods. For instance, regulatory bodies oversee utilities like electricity and water to ensure reliable and affordable access for all citizens. Fourth example, subsidies and grants. The government may provide financial support in the form of subsidies or grants to encourage the provision of public goods and private entities for individuals. This can be seen in renewable energy subsidies or grants for scientific research. Fifth example, public-private and partnerships or triple P. Governments can engage in partnerships with private entities to jointly finance, develop, and operate public goods. Triple Ps are often used for large-scale infrastructure projects like airports, highways, or public transportation system. It is important for governments to carefully access the needs of society, establish priorities, allocate resources efficiently, and ensure transparency and accountability in the provision of public goods. This helps to promote social welfare, economic development, and a better quality of life for citizens. The funding mechanism for public goods varies depending on the specific country, government structure, and the nature of the public good being provided. Here are some common funding mechanisms used by governments. First, taxation. Governments often finance public goods through taxation. Taxes can be collected from individuals, businesses, or specific economic activities. Example, include income taxes, corporate taxes, sales taxes, property taxes, and excise taxes. The revenue generated from taxes is pulled into a general fund which is used to finance various public goods and services. Second, user fees and charges. Governments may impose user fees or charges for the use of specific public goods or services. For example, tolls on highways, entrance fees to national parks, or fees for government-provided services like obtaining a passport or driver's license. These fees help cover the cost of providing and maintaining the public goods, partially shifting the financial burden to those who directly benefit from them. Third, government borrowing. In some cases, governments may finance the provision of public goods through borrowing. The issue bonds or other debt instruments to raise capital from financial markets. The borrowed funds are then used to invest in infrastructures, projects, or other public goods. The government borrowing. In some cases, governments may finance the provision of public goods through borrowing. The issue bonds or other debt instruments to raise capital from the financial markets. The borrowed funds are then used to invest in infrastructure projects or other public goods. The government repays debt over time, often with interest, using future tax revenues. Grants and aid. Governments may receive grants or financial assistance from international organizations, foreign governments, and philanthropic organizations to fund specific public goods or projects. These grants can supplement the government's own resources and helps address development needs or specific societal challenges. Fifth, public-private partnerships or PPP. Under a PPP arrangement, the government collaborates with the private sector to finance and deliver public goods. Private entities contribute funding, expertise, and resources in exchange for certain rights such as operating and maintaining the public good and potentially generating revenue from user fees. The government may also provide financial support or subsidies to intensive private participation. It is worth noting that the choice of funding mechanism depends on the factors such as the government's fiscal capacity, economic conditions, political considerations, public preferences, and the nature of the public good being provided. Government strives to strike a balance between raising sufficient funds to finance public goods and ensuring that the burden is distributed fairly among citizens and stakeholders. Maximizing accessibility means making public goods and services available to as many people as possible, regardless of their economic status, location, or physical abilities. Here are some strategies that governments can use to maximize accessibility. First, universal design. Public goods and services can be designed to be accessible to everyone regardless of their physical or mental abilities. For example, buildings can be designed with ramps, low steps, and wide corridors to accommodate people with disabilities. Websites can be designed to be accessible to people with visual impairments by using large fonts, high contrast colors, and screen readers. Second, geographical proximity. Governments can provide public goods and services in locations that are easily accessible to the populations. For example, hospitals and clinics can be built in areas with high population density and near public transportation system. Schools can be located in areas that are easily accessible to students from different neighborhoods. Third, affordable pricing. Governments can price public goods and services in a way that makes them affordable to everyone. For example, public transportation fares can be subsidized for low-income families, and public schools can be tuition free. This helps to ensure that everyone has access to the same quality of public goods and services, regardless of their income. Fourth, information and communication. Governments can use various channels to disseminate information about public goods and services to the public. This includes providing information in the multiple languages, using social media and other digital platforms, and providing information and accessible formats for people with disabilities. Fifth, public-private partnerships. Governments can collaborate with private entities to increase accessibility to the public goods and services. For example, private transportation companies can partner with the government to provide affordable transportation to understand areas. Private companies can also invest in building public infrastructure like parks, libraries, and community centers. Maximizing accessibility is crucial for promoting social inclusion, reducing inequality, and improving the quality of life for all citizens. Governments play a vital role in ensuring that public goods and services are accessible to everyone, and that they must continually evaluate and improve their strategies to achieve this goal. Common resources and the strategy of the commons. Common resources refers to the goods or assets that are held collectively and are available for use by a group of individuals. These resources are often characterized by being rivalrous. One person's use reduces ability for others, but non-excludable. It is difficult to prevent someone from using the resource. Examples of common resources include fisheries, grazing lands and forests, and clean air. The tragedy of the commons is a concept introduced by ecologist Garrett Hardin in 1968, which describes a situation where individuals acting their self-interest deplete or degrade a common resource to the detriment of the collective. The tragedy occurs when individuals prioritize their immediate and gains without considering the long-term consequences, resulting in the overexploitations or destruction of their common resource. The tragedy of the commons arises due to a lack of clear ownership, property rights, and effective management mechanisms for common resources. In the absence of regulation or cooperation, individuals have an incentive to maximize their own benefits, leading to unsustainable use and depletion of the resource. To address the tragedy of the common, various strategies can be implemented. First, establishing property rights, assigning clear property rights to individuals or communities over common resources can incentive responsible and sustainable management. This can be done through privatization, where individuals or groups are given exclusive ownership and management right over a resource. Second, regulations and governance. Governments can implement regulations and policies to manage common resources effectively. This may involve setting limits on resource use, issuing permits or licenses, implementing quotas, or establishing protected areas. Effective government structure such as community-based management systems or co-management arrangement can also empower local communities to make decisions regarding resource use. Third, market-based instruments. Market mechanisms such as tradable permits or cap and trade systems can be employed to allocate and manage the use of common resources. These mechanisms create economic incentives for individuals or companies to reduce their impact on the resource of allowing them to buy or sell rights to use it. Fourth, education and awareness. Promoting awareness and educating individuals about the importance of sustainable resource use can help change behavior and encourage responsible practices. Public campaigns, outreach programs, and environmental education initiatives can play a crucial role in fostering a sense of stewardship and cooperation. By implementing these strategies, it is possible to mitigate the tragedy of the commons and ensure the sustainable use and preservation of common resources for the benefit of present and future generations. Common resource examples are goods or assets that are held collectively and are available for use by a group of individuals. Here are some examples of common resources. First, fisheries, oceanic or freshwater fish stocks are often considered common resources. Fishermen have often access to fish in these areas, but the resource can be overexploited if fishing is not regulated, leading to depletion and ecological damage. Second, grazing lands. Pastures are rangelands used for livestock. Grazings are common resources in many agricultural communities. Overgrazing can occur if there are not restrictions on the number of animals allowed, leading to soil erosion and degradation. Third, forests. Forests are valuable common resources that provide timber, non-timber forest products, and ecosystem services. Deforestation and unsustainable logging practices can deplete forest resources and harm biodiversity and local communities. Fourth, clean air and water. Air and water are common resources that are crucial for human and environmental well-being. Pollution and overuse can degrade air and water quality, causing harm to ecosystems and human health. Fifth, public parks and recreational spaces. Public and owned parks, beaches, and recreational areas are common resources that provide opportunities for leisure, outdoor activities, and community gatherings. Overcrowding or inappropriate use can damage the natural environment and reduce the overall enjoyment for everyone. 6. Knowledge and information. Knowledge and information such as scientific research, open source, software, or public admin literature are often considered common resources. They can non-excludable and can be freely accessed and shared by individuals and the public. 7. The cultural heritages, sites, monuments, and traditions can be considered common resources that belong to a community or society. Conservation and management are necessary to protect this resource from degradation or exploitations. It is important to manage and sustain these common resources through effective regulations, governance and structures, and responsible individuals' behavior to ensure their long-term ability and benefit for all. Solutions through regulation. Regulations play a crucial role in addressing various societal challenges and ensuring the proper functioning of industries, markets, and public goods. Here are some ways in which regulation can provide solutions to different problems. First, environmental environmental protection. Regulations can be implemented to protect the environment and natural resources. This includes setting emissions standards for industries, regulating waste disposal practices, and establishing protected areas to conserve biodiversity. Environmental regulations aim to prevent pollutions, promote sustainable resource use, and mitigate the negative impacts of human activities on ecosystem. Second, consumer protection. Regulations can safeguard consumers by ensuring products safety, fair pricing, and accurate information. Consumer protection regulations may include requirements for labeling quality, standards, warranties, and regulations against deceptive advertising or unfair business practices. These regulations help build trust, promote fair competition, and protect consumers from harm or exploitations. Third, financial stability. Regulations are essential for maintaining the stability and integrity of financial markets and institutions. Regulatory measures can include capital requirements for banks, restrictions on risky financial practices, and rules for transparency and disclosure. These regulations aim to prevent financial crises, protect investors, and maintain the overall stability of the economy. Fourth, health and safety. Regulations are crucial for protecting public health and safety. They can include standards for food safety, workplace safety, product safety, and regulations for pharmaceuticals and medical devices. Health and safety regulations aim to prevent harm, ensure product quality, and establish guidelines for responsible practice in various sectors. Fifth, competitions and antitrust regulations. Regulations can promote fair competition and prevent the abuse of market power. Antitrust regulations can include measures to prevent monopolies, regulate mergers and acquisitions, and prohibit anti-competitive practices. These regulations aim to foster level playing field, encourage innovation, and protect consumer choice. 6. Labor rights and enjoyment practices. Regulations can establish minimum wage laws, limit working hours, ensure workplace safety, and protect against discriminations and exploitations. Labor regulations aim to protect workers' rights, promote their employment practice, and establish standards for decent work conditions. Effective regulation requires a balance between protecting the public interest and allowing for economic growth and innovation. It should be used on through analysis, stakeholders engagement, and ongoing evaluation to ensure its effectiveness and adaptability to changing circumstances. Positive externalities in public health programs. Public health programs often generate positive externalities, which are benefits that accrue to individuals or society beyond those directly involved in the program. Here are some examples of positive externalities in public health programs. First, disease prevention. Public health programs that focus on disease prevention, such as vaccination campaigns or public education on hygiene practices, can lead to positive externalities. When individuals receive vaccinations or practice good hygiene, it not only protects their own health but also reduces the transmission of disease to others, benefiting the wider community. Second, reduce healthcare costs. Public health programs that promote healthy behavior such as smoking cessations programs or initiatives to reduce obesity can result in positive externalities by reducing healthcare costs. When individuals adapt with their lifestyles, it can lower the burden on healthcare systems, leading to cost savings that benefit society as a whole. Third, improve the productivity. Public health programs that address occupational health and safety, mental health support, or workplace wellness initiatives can yield positive externalities in terms of improved productivity. When workers are healthy, physically and mentally, they are more likely to be productive, contribute positively to the economy. Fourth, social cohesions. Public health programs that promote community engagement and social support, such as a mental health awareness and campaigns or initiatives to combat social isolations, can generate positive externalities by fostering social cohesion. When individuals feel supported and connected, it can lead to improved mental well-being and overall community resilience. Fifth, healthy equity. Public health programs that focus on addressing health disparities and promoting equitable access to healthcare can generate positive externalities by reducing inequities in health outcomes. When disadvantaged and populations have better access to healthcare and health education, it can lead to improved overall health for the entire society and contribute to a more equal and inclusive society. It is important to recognize and consider these positive externalities when evaluating the impact and value of public health programs. By understanding and quantifying these externalities, policymakers can make informed decisions and allocate resources effectively to maximize the broader benefits for society. Vaccination programs. Vaccination programs are public health initiatives that aim to prevent the spread of infectious diseases by administering vaccines to individuals or populations. These programs have numerous benefits and positive externalities. Here are some key points about vaccination program. First, disease prevention vaccination programs play a vital role in preventing the spread of infectious diseases. By administering vaccines, individuals develop immunity to specific diseases, reducing the likelihood of infection and subsequent transmission to others. This helps to control and eliminate diseases that are once widespread, such as polio, measles, and smallpox. Second, public health impact vaccination. Vaccination. Vaccination programs have a significant impact on public health by reducing the burden of vaccine-preventable diseases. They have been instrumental in preventing millions of cases of illness, hospitalizations, and deaths worldwide by preventing the occurrence of transmission of diseases. These programs contribute to overall improved health outcomes and increase life expectancy. Third, herd immunity. Vaccination programs also generate a positive externality known as herd immunity or community immunity. When a significant portion of the population is vaccinated, it creates a protective barrier against the spread of diseases. This directly benefits vulnerable individuals who cannot receive vaccines due to age. Health conditions are other factors. Herd immunity helps protect those who are unavailable to vaccinated, such as infants, elderly individuals, or individuals with compromised immune systems. Fourth, economic benefits. Vaccination programs yield economic benefits at both individual and societal levels. By preventing diseases, vaccination reduces medical costs associated by treatment, hospitalizations, and long-term care. It also helps control disease outbreaks, which can have economic impacts such as reduced productivity, increased healthcare expenses, and strain on healthcare system. Fifth, global impact. Vaccination programs have global implications as infectious diseases can easily cross borders. International efforts such as the World Health Organization expanded program on immunization aim to ensure equitable access to vaccines and support vaccination programs in low-income countries. By preventing the spread of diseases globally, vaccination programs contribute to global health security and promote the international collaboration. It is important to note that successful vaccination programs require high vaccination coverage rates, public trust in vaccination, accessible healthcare services, and effective communication to address vaccine hesitancy. Public health authorities and healthcare providers play a crucial role in implementing and promoting vaccination programs to maximize their benefits and protect public health. Health education campaign. A health education campaign is a targeted effort to raise awareness, disseminate information, and promote positive health behaviors with a specific population or community. These campaigns aim to educate individuals about health-related topics, encourage behavior change, and empower people to make informed decisions about their health. Here are some case aspects of health education campaign. First, objectives and target audience. A health education campaign begins by identifying clear objectives and defining the target education. The objectives may include increasing knowledge about a specific health issue, promoting healthy behaviors, or encouraging individuals to seek preventive healthcare services. The target audience may be a specific age group, community, or population with common health concerns. Second, information and messaging. Health education campaigns rely on accurate and evidence-based information to educate the target audience. The messaging should be concise, clear, and tailored to the specific needs and characteristics of the target audience. It should address common misconceptions, provide actionable steps, and emphasize the benefits of adopting healthy behaviors. Third, communication channels. Choosing the right communication channels is crucial to effectively reach the target audience. This may include a combination of traditional media, television, radio, print, digital platforms such as website, social media, community engagements, events, or partnerships with local organizations and influencers. Utilizing multiple channels ensure that the campaign message reach a diverse range of individuals. Fourth, health promotion strategies. Health education campaigns often incorporate various strategies to promote behavior change. This may include providing educational materials, organizing workshops or seminars, offering pre-screens or vaccinations, distributing resources such as brochures or posters, and using social media platforms to share health tips and information. Interactive activities such as quizzes, challenges, or games can also engage participants and reinforced by key messages. Fifth, Partnership and collaboration. Collaboration with healthcare professionals, community organizations, schools, and other stakeholders is essential for the success of a health education campaign. Partnerships can help leverage research, access target populations, and ensure the campaign's credibility, engaging local leaders, influencers, and community members as campaign advocate can also enhance its reach and impact. Sixth, evaluations and feedback. Monitoring and evaluating the campaign effectiveness is crucial to assess its impacts and make necessary adjustments. This can be done through surveys, focus groups, data analysis, or taking key health indicators. Feedback from the target audience and stakeholders can provide valuable insights for future campaigns and help define messaging and strategies. A well-designed health education campaign has the potential to empower individuals, promote healthier behaviors, and contribute to improve health outcomes with a community or population. Sanitation initiatives. Sanitation initiative refers to efforts aimed at improving access to safe and adequate sanitation facilities and promoting proper hygiene practices. These initiatives are essential for public health, environmental sustainability, and overall well-being. Here are some aspects of sanitation initiatives. First, access to sanitation facilities. Sanitation initiatives focus on ensuring that individuals and communities have access to safe and hygienic sanitation facilities. These include toilets, latrines, or other appropriate sanitation systems. Improving access to such facilities helps prevent and contamination of water source and the spread of waterborne diseases. Second, hygiene promotion. Sanitation initiatives often incorporate hygiene promotion as a key component. These campaigns aim to educate individuals about the importance of proper handwashing, personal hygiene, and other hygiene practices. Promoting good hygiene behaviors helps prevent the transmission of diseases and reduces the overall burden of illness. Third, behavior change. Sanitation initiatives strive to bring about behavior change by raising awareness, providing education, and addressing cultural and social norms related to sanitation and hygiene. They aim to encourage individuals and communities to adopt and maintain proper sanitation practices, such as using toilets, practicing in hand hygiene, and safety disposing of waste. Fourth, infrastructure development. Sanitation initiative may involve the development of necessary infrastructure such as the construction of community toilets, latrines, or sewer system. These infrastructure projects aim to provide safe and sustainable sanitation solutions, particularly in areas where access to facilities is limited or inadequate. Fifth, wastewater management. Effective sanitation initiatives recognize the importance of proper wastewater management. They include strategies for the safe disposal and treatment of wastewater for prevent and contamination of water bodies and minimize environmental pollutions. This may involve the establishment of wastewater treatment plants, recycling systems, or the promotion of eco-friendly sanitation technologies. Sixth, community engagement and successful sanitation initiatives involve active community engagement and participation. This includes engaging community members in the planning, implementation, and maintenance of sanitation facilities and practices, engaging local leaders, community-based organizations, and promoting ownership and responsibility among community members help ensure the sustainability and long-term success of sanitation initiatives. 7. Policy and governance sanitation. Sanitation initiatives require supportive policies, regulations, and government struc- ins- structures or various levels. Governments, international organizations, and other stakeholders need to prioritize sanitation, allocate resources, and establish guidelines and standards for sanitation facilities, and practice effective policy frameworks and coordination mechanisms help create an enabling environment for sanitation initiatives to thrive. Sanitation initiatives had a broad impact on public health, environmental sustainability, and overall quality of life. They contribute to reducing the incidence of waterborne diseases, improving overall hygiene practices, and protecting the environment and promoting dignity and well-being for individuals and communities.